So my name is Helen Stanton and I'm a clinical lead paediatric dietitian working for Wirral Community Health and Care Foundation Trust. So there are a group of children on the Wirral who have a condition called paediatric feeding disorder. So due to early life experiences, whether that's physical disability, illness, social issues, or psychological problems, they do not have age-expected feeding behaviours. And this can lead to a lot of problems because they've missed the opportunity to develop those feeding skills, which we all just take for granted. So you may have much older children who don't have the ability to chew, swallow and eat normal foods like their peers do. And those children fall under a diagnosis of paediatric feeding disorder. Unfortunately, there is nowhere to refer those children for specialist medical or support. So what happens is a lot of these children get referred to children's dietetics because people rightly think it's an issue with feeding and eating. So they get referred to our service. And our service currently isn't commissioned to see those children. So we have to reject those referrals. And there is nowhere to signpost families to because there are no other services on Wirral that see them. Consequently, families end up struggling at home with their children, trying to feed them. It has long-term implications for the children's health and well-being, for their growth, for their development. And it can be a huge source of stress for the whole family. So we really felt that those children and families deserved to have a service locally. So I've always been really passionate about making quality improvements in our service. We're quite a small team, but we're very forward thinking. And the opportunity to take part in the Cheshire and Merseyside Leadership and Quality Improvement course was offered out via email. I'm the quality improvement link person lead for our team. And once I saw it, I thought that sounds like a perfect opportunity to help me with this particular project we're doing and to learn more about myself and my leadership skills and how I can best direct this project to get a really good outcome from it. At the moment, when I first started out on the quality improvement journey, which is just before I'd enrolled on the course, we had really quite lofty ideas about delivering this great big service. And what we know from experience is successful outcomes for children with paediatric feeding disorder only occur if it's a multidisciplinary approach and it's very intensive support. That's where you get the best outcomes. So we approached all the other disciplines that would need to be part of this team, including speech and language therapy, occupational therapy, the paediatricians and CAMS to see if they would be on board with doing this with us. And while everybody thought the idea was fantastic, everybody was in the same boat as us. So they didn't have the capacity to release staff to be part of the project. And they knew that going forward, they would need funding to be able to do that. So I then started on the quality improvement and leadership program, and it really made me evaluate that maybe we were aiming too high too quickly. And we really rethought our whole approach to the project, and we decided to take a step backwards, and rather than jumping in with 2 feet and trying to do everything straight away, what we really needed to do was develop evidence and collect evidence to show that there was a need for this service. Anecdotally, we knew there was a need because the referrals were coming to us and we were rejecting them. And then we were receiving complaints from parents and families who were struggling and didn't know where to go with their issues around feeding. To date, what we have done is we've done a smart survey with our acute and community paediatricians locally. We've also done a smart survey with the health visitors. We've had the results back from those, which has really shown what we thought it would, which is all of these services see children with this diagnosis, don't have anywhere to refer them to, and don't necessarily feel adequately trained or equipped to deal with them. So it really does demonstrate that the need is there. We went back and we looked at our rejected referrals, and we found that up to 30% of our rejected referrals were for children who would probably meet the criteria for paediatric feeding disorder. We are hoping to run a pilot of an assessment clinic and some initial parent group education sessions in September. and we have designed the pathway, the assessment paperwork, and the actual content of the group education sessions for September. I think it has been really, really useful because it's been a really practical course. So a lot of courses have great theory and, you learn an awful lot, but then you don't always get the opportunity to put that into practice in real life. And this course was very much about the theory and the practice and then the immediate application of that to your real life situation. So everybody who was on the course had a quality improvement project that they had already started, and everything we were learning, we were applying it to that project. And in between each session, we had action learning sets where we would get together in smaller groups and discuss our projects, where we were up to, how we'd applied the learning that we'd had in the previous module. And also it gave us an opportunity to meet other people from other areas of the trust, from other disciplines that we might never have come across, and for them to give their perspective on our projects and give advice and feedback. And that was really, really useful as well. I think I'm proud of the fact that as a small service, we do take the time to listen to our patients and what the community wants, and that we try and put that into practice. And I think the course has given me the tools to be able to do that. I think sometimes frontline staff know what the issues are and know what's needed, but it sometimes feels like management levels are speaking a different language and they're the one who holds the funding and the strings to be able to allocate service provision. And I think this course has allowed me as a clinician to be able to develop the evidence that's needed and use the language that needs to be used in order to get kind of those who allocate services and allocate funding to be able to listen to us and hopefully, come through for our community and our families and our service to be able to deliver this programme. I would encourage anybody who has an interest in quality improvement to engage on the programme, particularly if you have a project in mind and you're just not quite sure how to take it forward. It really helps, or even if you've started to take it forward and you've met lots of barriers, because it really helped us to think about different ways to overcome the barriers. And really reflect on what we were doing and approach it sometimes from a different angle. And I think that's really helped me in my journey with our quality improvement project. And I think it will help others, because sometimes we're all so busy in the NHS and there's such a lot of pressure on everybody. Sometimes, lots of times, people have great ideas, but they soon come up against barriers, and because of due to lack of time and resources, that often stops people in their tracks. Whereas I think this project will enable you to keep going with it and actually bring it forward and have something real to show at the end of the course.